In health news this morning, cancer death rates are falling because of medical advancements and public awareness. A report published in the medical journal Cancer finds that overall cancer death rates decreased by 2.1% from 2015 to 2019. The number of people diagnosed still remains the same, and diagnoses in women and young adults aged 15 to 29 have increased. The CDC reports that some cancers continue to impact patients at high rates, such as breast, kidney, pancreas, myeloma, and others tied to obesity, diabetes, and general inactivity. Now, for more on this positive medical information, I'm joined now by Dr. Jane Morgan. She's a cardiologist, also the executive director of health and community education at Piedmont Healthcare Corporation. Thank you very much for joining us, Doctor. We appreciate your time here.
Good morning.
So we have some hope here, and this drop in mortality. We just read better habits, more awareness. What are you seeing? What is causing this decrease in cancer death rates?
One of the things that we look at is when we talk about lung cancer, we have fewer people smoking, which is always good news. And we think that is translating to these lower death rates and diagnoses, specifically for lung cancer. People are not smoking, but there's also better awareness, better therapies, better workup, and better treatments as well. And so lung cancer is one of those areas where we've made really great strides.
This seems to have been a multi-decade effort that, after all of this time, is finally bearing some fruit. Do you see it that way?
We certainly see it that way, but we also want to have a bit of caution in our younger demographic, where we do see cancer diagnoses and those rates of cancer increasing. And we think that that may be related to not only obesity, but the duration of time that you are obese. We used to see people putting on weight in their 40s and 50s and later in life. We see people now with obesity as young as childhood. And so when they reach 40 or 50, they've already had 4 to 5 decades of being overweight. And we think that is propelling many of these diagnoses, because most of them are related to the digestive or GI tract.
Could the diagnosis rate be good, though, because we're finding out sooner? We're finding out that people have these problems and can maybe do something about it?
You know, Mitch, that is such a great point. Absolutely. Because of guidelines, we absolutely are catching cancers as we should, as part of our preventive care. But what we see in the younger demographic as well is that they can slip through the cracks because they have not reached the age yet when cancer screenings and cancer guidelines really begin. And that includes colonoscopies, breast cancer screenings. And so if they develop these cancers younger, they may actually be diagnosed later because they are not getting the screening because they're not quite old enough yet. So that's something we absolutely have to take a look at as well.
Sure. I know I'm in my mid-30s, and I think that the timeline for when you're supposed to get things like a prostate exam, a colonoscopy, that's usually about when you turn 40. But are you talking about people that are my age, that are not quite old enough to get those diagnostics done? Or are you talking about kids here?
I'm talking about people your age and younger, people who are not quite old enough to get those diagnostics done. That is actually a really great way to put it. And so we want to take a look at that, because we see that there's really a correlation with obesity, diet, processed food, and the duration of time that someone is in that overweight state, that has that elevated BMI. And so we absolutely want people to move away from sedentary lifestyles and to try to walk more. Absolutely, walking is very good. And to try to develop more of a plant-based diet, decrease the amount of meat in your diet. And then absolutely, if you're smoking, quit smoking. If you're not smoking, don't start. If you're living with a smoker, try to encourage them to quit smoking as well.
The smoking is not a problem for me. The meat is. I'm what I call a meatitarian. If the meal doesn't have meat, it's not really a meal. So you you've caused a shift in my brain. I might need to talk to my doctor and maybe make some changes in my diet. Dr. Jane Morgan.
Modify just a bit. Just modify a bit.
All right,
right.
That's Dr. Jane Morgan dispensing the medical advice. Thank you very much for joining us this morning.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.